Oh, absolutely. I use AI every day, whether it's using for prior authorizations, helping identify and apply guidelines, but it's excellent in helping identify a treatment protocol on those complex or difficult patients where it's kind of these gray zones. So for me, I had a patient with bladder cancer, an intermediate risk patient, non-muscle invasive bladder cancer, but unfortunately, positive psychologies, no visible lesions, upper tracts negative on imaging studies. And the question is where to go with this patient? What do you do? Now, the guidelines are really not very ripe in this area. So the best thing to do is to dive into the literature. But the literature is vast and it can take hours searching through PubMed, Google Scholar. That's where AI helps. AI can help identify searches, collate all the information from the literature, pare down, and help you identify and streamline a protocol or an approach for a particular patient. In this patient, it helped identify a potential streamline approach of monitoring and serial radiologic studies, serial cystoscopies, cytologies, and other molecular diagnostics that really did help identify and monitor this patient in the long run. AI was able to streamline hours worth of data searching into only about a few minutes and give a printed report that helped me just collate through everything very rapidly for this patient. As with any AI being a newer technology, it's not ideally suited to be infallible. It has flaws. Everybody knows about AI and the risk of what they call hallucination, that it can confabulate, make things up. So you have to trust it, but to a point. The old saying is trust but verify. So when AI creates something, when it gives you an answer, you have to use your human side, all the knowledge you've gained, your experience to see, is that right? Does it make sense? And sometimes you have to look and see, is it true what it's saying? There are times when I've actually used different models. I don't always trust one particular model, whether I'm using Gemini, whether I'm using ChatGPT, whether I'm using the Doximity platform. A lot of times what I'll do is I will run the same query through 2 or even 3 different types of predictive AI models and see if I get the same answer. If I don't get the same answer, then I know somewhere it's not correct. And it only takes a few minutes, especially if you already have the data sets prepared. Like if I already have the patient chart already saved as a PDF and just dump it into the predictive model, ask my query, ask it to search the data sets and see what answers I get. But sometimes I get the same, most of the time I'll get the same answer. Sometimes you don't. And you also find that a lot of these AI models are very different in how deep they'll dive, the types of answers you'll get, and how they collate the information and produce it back to you. So it can be difficult in finding these problems where you don't always trust the AI. So as the models get more robust, we feed more data sets into them and the computational power increases, that should decrease, especially with more modern AI with the self-check protocols that are being built in. But still, we're ultimately in control. We're ultimately the provider. We're ultimately the human controlling the query, and we have to control the data. And we have to entrust and ensure the data that comes out is verifiable. That's correct. That is correct. Unless you can find an AI tool that has a particular well-designed chatbot that's associated, or you've become comfortable, or a lot of times the AI is based on your query, how you put the information in. And it takes time to become efficient. It takes time to train the AI. Once the AI is properly trained with the proper feedback, you get more comfortable in trusting that particular AI model. But you should always trust but verify. You know, we go through medical school for a reason. We go through our residency training for a reason. We keep up on a continuing education for a reason. You know, we can't let AI ultimately replace us. It's an augmented tool to help us streamline our capabilities and enhance what we do. But ultimately, the bottom line is it stops with us, and we have to make sure that we're doing the right thing and that the AI is correct. It's no different than if I'm in my office and I have an advanced practitioner coming to me with a patient. I have to listen to what they're saying. I have to evaluate the patient, understand the data set, and I have to make an independent determination and see if they match. The AI is no different. Oh, absolutely. Absolutely. I think it's a two-way street. I think that the AI is going to influence the guidelines, and the guidelines are going to influence the AI, and they're going to feed back on each other. AI has the ability to rapidly collate and integrate information. And one of the downfalls of guidelines is that they take time to produce. It takes time to upgrade and update the guidelines based on current data sets and literature. The NCCN guidelines are updated every year, but the American Urologic Association guidelines are only every 3 to 5 years, depending on the guidelines. The the AI data sets and capabilities are going to streamline the process for guideline updates so that the guidelines probably could be updated every quarter, every 3 months instead of yearly for the NCCN guidelines. And in turn, the AI can then incorporate literature in the guidelines to give better patient care. It's going to be a continuous feedback loop that's just going to improve medicine. Right now, AI has made the greatest impact in prostate cancer. Most in the beginning, the most notable is in diagnosis, with AI diagnostics helping identify lesions on multiparametric MRI to help target biopsies. It's making the diagnostic capability of prostate cancer much more sensitive, weeding out false positive, false negatives, and helping target prostate cancer lesions on biopsies on MRI. AI has become very useful in that space. But on the flip side, AI is becoming more ubiquitous on the treatment side, helping apply the protocols and guidelines for better treatment and protocol outcomes for patients. Prostate cancer really is the avant-garde in AI right now in the urology space, but that's going to be rolled out and starting to expand into the bladder cancer space and renal cancer space and in other protocols. And really, it's going to be more ubiquitous, and people aren't going to realize it's just going to be running in the background once it's integrated into their EMRs. And it'll almost take a lot of the guesswork out in applying the guidelines. It'll monitor your patient progress. It'll monitor your charts and start giving you guideline recommendations and even literature recommendations based on the patient parameters. Absolutely. I think that would be a universal statement right now, and it's just going to roll out into other spaces. There are a lot of AI has a great ability to collate the information and help streamline algorithms and protocols. And prostate cancer is incredibly complex with rapidly changing environment, especially with the new oncolytics, treatment protocols, the new diagnostic measures, the new radioligand pharmaceutical treatments that are becoming available. It's a lot of information to collate, and AI is excellent at doing that. And we're seeing the same data set issue when it comes to bladder cancer, a lot of protocol treatment issues that are complex for identifying the risk buckets of individual patients, where they fall, and what would be the best treatment option and the treatment protocol stepwise ladder fashion for them to give them the best outcome. And AI is wonderful as a tool for that. That's a loaded question because there are so many issues depending on who you speak with. On the patient side, there's a fear. There's a fear that the human interaction is going to be replaced, that you're just going to trust a machine. It's almost like Dr. Google, but Dr. Google isn't always right. So patients fear AI as a replacement. Colleagues are somewhat fearful for numerous reasons. They're concerned about AI, again, not being right and being left in the lurch, so to speak, when it comes to medical malpractice and liability. But it's also the compliance side that people worry about. With AI having the ability to access data sets, what's the privacy issue with AI entering into charts? Where's this information going? Who's controlling the information? And who's going to have access to the information? That has to be controlled. And a lot of my colleagues, we discuss this and say, there are no definitive stopgaps. The AI is rapidly advancing, much more so than the legislator and regulatory environment can keep up. So there have to be some sort of safety measures put into place to protect, you know, privacy and data sets so that the data doesn't get out there. Oh, I absolutely think it will. As AI becomes more ubiquitous and known, as I said, AI has been around for ages, decades, and people don't even realize it. They don't even realize that they're dealing with AI on a routine basis. It could be you just pick up the phone and call customer service for your local utility company, and most people don't realize that's an AI chatbot agent that's being used as a screener, that it sounds human-like, but it's acting as a screener to answer and interact for the most basic tools before it goes to a human representative. As people become more comfortable with the artificial intelligence interactions, they'll become more accepting and it will become more ubiquitous and we'll see it really in the forefront. It's going to be like Star Trek, where you're going to sit in your kitchen and talk to your whatever smart device it is and say, computer, blah, 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 and it will help you identify and figure out the problem. It's really cutting edge, and people are going to become more accepting as time goes on. AI is here to stay. AI is here to stay, and we need to learn how to utilize it as the tool it is. Like just like any other tool, it can help us. We shouldn't rely on it fully. We have to trust but verify. But it is here, and it is important to identify how AI can be fully integrated into urology practice and healthcare protocols, not only for helping us on the healthcare management side, but on treating patients. But AI is here and it's not going anywhere.